I am Sean Seckinger. I am a occupational therapy student at the University of St. Augustine. This is my critical appraisal form for physical modalities for occupational therapy. My critical appraisal form looks into a comparative study of effectiveness between superficial heat and deep heat with static stretching to improve plantar flexor flexibility in females who wear high-heeled shoes. This was taken from the Indian Journal of Physiotherapy and Occupational Therapy by authors H. Patel, D. Desai, H. Soni, K. Soni, and C. Shah. This study is a cohort comparative study with level 2 evidence shown by randomized sampling and a sample size less than 100, 40 to be exact. Methodology for this study includes a hypothesis that looks into the effectiveness of superficial heat in the form of moist hot pack and deep heat in the form of ultrasound, combined with static stretching on improving plantar flexor flexibility in females who wear high-heeled shoes. Additionally, this study looked into the comparison of superficial versus deep heat on the above treatment in improving plantar flexor flexibility. Inclusion criteria for this study included females who were between the ages of 18 and 30 who wore high-heeled shoes greater than or equal to 2 inches in height. Additional criteria included females whose current ankle dorsiflexion range of motion is less than 10 degrees from normal with knee extension. Exclusion criteria includes individuals with impaired sensation or current orthopedic condition, as well as individuals with a current hip, knee, or ankle neuromuscular disorder, as well as people with a current ankle pathology, for instance, a fracture. Outcome measures that were utilized for this study included a universal goniometer, which was used to assess active range of motion, as well as some statistical tests, which included a unpaired t-test, which was used to test the homogeneity between both groups, both pre and post intervention, as well as a paired t-test, which looked into the significance of ankle dorsiflexion range of motion, both pre and post intervention. Results found were that there was a significant difference that was seen between or within group A, the superficial heat, as well as group B, the deep heat, between pre and post treatment. However, authors found that group B, the deep heat, found a greater significance as opposed to group A, superficial heat. Conclusions. Both groups yielded statistically significant results post-intervention in the form of increased plantar flexor flexibility. However, as stated previously, group B yielded even better results than the superficial heat. This can be explained probably because of the increased muscle temperature, which was facilitated by the ultrasound, which also served to facilitate increased muscle relaxation. Static stretching with a heat modality, either deep or superficial, has been found to yield greater muscle lengthening as opposed to just static stretching alone. Some of the strengths of this study include that this is new research in the form of a comparison of the effectiveness between superficial and deep heat modalities. Some limitations of this study, however, are it is a small sample size is used, 40 individuals, as well as a short time frame that this study took place in, as only 3 weeks were utilized. Clinical bottom line that we can take away from this is that high-heeled shoes are a common fashion accessory that has been found to be related to negative effects such as plantar fasciitis, back pain, bunions, and toe deformities, to name a few. As therapists, when treating the cause of these pathologies, such as adaptively shortened plantar flexors, often we will stretch an individual, But this study looks into the effectiveness of combining stretching with a heat modality and looking into the comparison of a deep versus superficial preference. By facilitating increased plantar flexor range of motion, we can increase participation in activities of daily living and increase a patient's quality of life and overall wellness. Therefore, further research into the effectiveness of deep versus heat modalities and its correlation and related improvement with stretching is of importance to future therapeutic interventions.